Good morning. Denisha, would you do a roll call, please?
Yes, Chairman. I'll begin with Norman Boyd,
Here.
Roger Folsom,
Here.
Russell Crutchfield,
Here.
David Cruz,
Here.
Anthony Williamson,
Here.
Russ Childers, Kenneth Davis, Nelva Lee,
Here.
Cynthia Rucker,
Here.
and I'll go back to the missed attendees. Russ Childers, I thought I saw your name on there, Mr. Childers. Maybe your mic is muted. Russ Childers, Kenneth Davis, thank you, Chairman. That concludes my roll call.
Okay, thank you, Denisha. And that with the attendees that we have, we do have a quorum to conduct business. So we'll move right into the agenda and thank all of you for participating this morning. Our agenda this morning, as a board, we will be asked to consider one item for a final adoption and two items for initial adoption. Before we move into that, the first thing on the agenda here is the minutes of the January 13 meeting, and I'll call on Russell Crutchfield, our secretary, and ask if he has read the minutes and can recommend those for approval.
Good morning, Mr. Chairman. I have reviewed the board meeting minutes from the January 13th board meeting, and I have found them to be correct and in order. And I move that we approve the board meeting minutes from the January 13th board meeting.
Thank you, Russell. His recommendation for approval. Is there a second to that?
Second, Mr. Chairman, Roger Folsom.
Roger Folsom has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing no opposition, the minutes are approved. Thank you, Russell. Thank you for that. Next, I will move on to the committee reports. We had a care management committee meeting, I believe, and call on Anthony Williamson, chairman of the care management committee, for his report, please.
Thank you, Chairman Boyd. We did have a care management committee meeting this morning. We had a really good meeting. I appreciate the work that Lynette Rhodes and others are putting into this committee. We started off by reviewing a draft charter for the committee. This was something that was discussed in our prior meeting that would help provide clarity as to the purpose of the committee, what its purview is. And I think one of the key takeaways that Lynette placed in the charter is that it allows for the committee members to hear of major initiatives and help them prepare to advise the board at large in oversight of the department. So really good discussion there on the charter. That charter is a draft. It will come back to the full board for approval at a later date. After that, we had a really good report from Dr. Holloway and Carla Willis regarding the care management organization dashboard. This looks at a variety of measures from the various CMOs, Peach State, AmeriGroup, CareSource, and the like. And the dashboard is organized across 4 pillars that look at access to care, quality of care, stewardship, and the overall service experience. And those metrics are rated on a star system And this is an effort to focus on transparency to members and to the public. And the dashboard is available on the department's website for review. So we had a really good, review of the content of that and the purpose, and it's a great tool. And then we moved on to some new business. Lynette Rhodes updated us on the federal public health emergency that we are under. We know that it's been extended recently for another 90 days, but the department is continuing or is beginning to prepare for the end of the public health emergency, as will be announced by CMS. And that will mean some work for the department in looking at how that impacts a number of Medicaid enrollees. We'll need to reach out to those enrollees. There's certain flexibilities and waivers that have been in place under the public health emergency. And there will be a need to contact those enrollees, as some of them will most likely no longer be eligible after the end of the PHE. And then the last thing that she updated us on are some procurements that the department is working on, which includes procurements for the CMO, as well as the GAMIS system, GAMIS. This is the major information system that handles claims management, provider enrollment, et cetera. And that is something that is going to be procured by the department, or that process is starting soon as well. That was, we had some good questions and dialogue, and that was the end of our committee meeting this morning. So thank you for the opportunity to give that report.
Thank you, Mr. Williamson, for your report. And is there any questions for Mr. Williamson or comments from the board, please? Hearing none, thank you again. And we will move on to Commissioner's report. And Commissioner Noggle, would you give your report, please?
Good morning. Thank you, Mr. Chairman. Appreciate the opportunity to share some updates with you and the rest of the board this morning. I'll start with some general updates related to the legislative session. I think the last time that we met was just before the governor had released his budget recommendations. So I just want to share some highlights for you, and really just want to set this up with how awesome this amended FY22 and FY23 budget are for the Department of Community Health. It really almost took my breath away of how much funding and how much opportunity we're going to have to do some really good new initiatives with the funding that the governor has recommended. And so we're thankful to him for his leadership and commitment to healthcare in this budget. But all of our normal items are included: Medicaid growth, annual clawback items, things like that are that we normally see in the budget were included in both versions of the budget. There's also some new things I just wanted to highlight, some things that this board has considered for adoption previously, inclusive of the coverage for the participation in clinical trials, which the board approved in December, additional funding to cover the cost of donor breast milk for very low birth weight newborns. There's an additional $16 million recommended by the governor in our amended budget to support both increased contract services costs, as well as some of our Medicaid enterprise system transformation activities, but also funding for a $5,000 pay increase for all of our employees that have been here, which is so timely and so appreciated. And we can't thank him enough for his leadership in that. And we look forward to the legislature continuing to support that. In FY23, we see some of those same things included in our budget, but also funding to implement express lane enrollment, also to address some other issues like attestation, continuing the clinical trials coverage, extending postpartum Medicaid coverage from 6 months to 12 months next year, expanding therapeutic services statewide, and additional behavioral health services procedure codes being opened up. So in total, there's also some reductions related to savings due to the enhanced FMAP that will extend as part of the federal public health emergency. But all told, about a little over $6 million being added to our budget in the amended year, and over $500 million being added in FY23, according to the governor's budget recommendations. So super appreciative of that and excited about the opportunities that those budget items will have for us. The House passed out of committee this morning their version of the budget, so we'll start digging in and take a look at that. We've got Senate hearings on that starting next week, and so we'll keep the board updated as those things progress. We don't have any agency legislation this year. We're obviously working in collaboration with many legislators on many different bills, including the Mental Health Parity Act, and so we'll stay engaged in those conversations. A couple of specific items I wanted to share with you a little bit procedurally. Earlier this year, the board approved rate increases that were included in the FY22 appropriations bill and funded in part by additional federal funding or the enhanced FMAP for certain home and community-based service providers as part of ARPA. Those rates and several other items were included in our initial home and community-based services spending plan that we submitted to CMS. They have partially approved that plan and we'll continue to work with them and submit quarterly updates. Earlier this month, we did submit a revision to include an additional rate increase that was not part of the budget but that we are still pursuing for one additional provider type, providers enrolled in the Georgia Pediatric Program, or GAP. This program provides in-home skilled nursing to serve medically fragile children under the age of 21. And just with the other rates submitted, we're hopeful this will encourage and retain providers in that critical program. Upon CMS's approval of that piece of the home and community-based services spending plan, that item will come back to the board as an action item at a later date. One other item, as most of you are aware, the department requested a number of waiver approvals for certain federal regulatory requirements and to get various flexibilities due to the public health emergency. That waiver was approved by CMS at the start of the public health emergency and helped to ensure our members maintain access to services. This past fall in November, we submitted an additional related waiver request called the Managed Care Risk Mitigation COVID-19 1115 Demonstration Waiver. It provided the department with flexibilities in our managed care rate setting process to provide for certain risk adjustments related to COVID. That waiver has been approved effective January 18th. And so no further action is necessary officially, but part of the waiver approval includes kind of a non-routine post-approval public comment period. So no actions required by the board, but we will be posting a copy of the application, the waiver approval letter, and the associated materials on DCH's website. And the public will have opportunity to submit written comments on that waiver through March 14th. A couple items on today's agenda I wanted to highlight. In January, the board approved for initial adoption a rate adjustment as a result of our work with psychiatric residential treatment facilities, or PRTFs. Through that public comment period, feedback and conversation and analysis, you'll hear today come back before you consideration of a recommendation to further increase those rates as we try to bring those Medicaid rates up a little bit in order to preserve bed capacity and availability for Georgia citizens that need those beds. So looking forward to that. In January, I also mentioned work surrounding a new state-directed payment program that would result in leveraging additional federal funding to ultimately reduce uncompensated care costs in Georgia. And then it would really be a multi-step process. You'll be presented with the first of those steps today, and Ryan Loke will present that and walk you through it in detail, but I'm still really just want to call attention to that. We're excited about the opportunities that that program is going to provide for us to work again towards better health outcomes for Georgians and to ultimately reduce costs and expand access. In internal news, a couple of staffing announcements. Rich Kim has been serving as our interim budget director for the past few months, and I'm pleased to announce that on February 1st, he's been appointed as our new permanent budget director. Very thankful for his tenure and service to the department and his institutional knowledge, and he's really just a pleasure to work with. Similarly, I've asked Terry Conrad, our current SHB accounting manager, to step in and serve as our interim comptroller. He has advanced coursework and degrees in accounting and has previously served as one of our auditors for the Department of Audits. And so I'm happy that he's agreed to serve in that role. And finally, David Graves has joined us this past month as our new director of communications. He comes to us from the private sector, so happy to have him on board as well. Happy to share that DCH recently won an award. Doesn't happen often, and I take great pride in things like this. So I want to thank the staff for their participation in the state charitable contributions campaign. We won an award from the Department of Administrative Services for the Stellar Award for contributions made by an agency of our size. We had a fun time with some of the ways in which we were raising funds, and so I look forward to future opportunities to engage with the staff and working towards service-oriented missions like that as we do our work. Would like to take a moment and recognize the life and service of Elwood Ebb Oakley, who has served as a CON appeal panel hearing officer for over a decade, from 2008 to 2019. He passed away in January. He was very passionate and committed to serving the healthcare community and really took great pride in his work as an appeal panel hearing officer. He will be missed, and we just want to extend our condolences to his family, and just we're ever thankful for his service. And finally, just as I always like to do, highlight some staff milestones within the department. Chandra Gladman, Barbara Simmons, Martha McKenzie, Michelle Robinson, Jerome Greathouse, Tracy Flowers, and Kimberly Spellman are all celebrating significant work milestones with DCH in the state. So thankful to them and their service and tenure to both the department and the state. Happy to answer any questions, Mr. Chairman, but that concludes my report.
Thank you, Commissioner, for that very positive news that you've delivered in very comprehensive report. Thank you very much, and congratulations for the department for the award on your work in the contribution area. Thank you. Are there any comments or questions from board members, please? Hearing none, we will move to our first item to consider today for final adoption, and I can strike out the word interim on my agenda here, as Rich Kim is now budget director and will lead the conversation discussion, and will be asked to vote at your conclusion. Please proceed.
Thank you, Mr. Chairman. Good morning, Mr. Chairman, Commissioner Nagle, and the members of the DCH board. Last month, I presented for initial adoption to update the nursing home reimbursement rate to use the 2021 general and professional liability insurance costs. The effective date of this proposal is February 1st, 2022, and it is to be updated at a minimum of every 2 years. During the transition year, the department will apply a hold harmless provision to the nursing home reimbursement rates, and the hold harmless provision will be in effect through June 30th, 2022. An opportunity for public comment was held on January 19, 2022 at 10:30 a.m. via Zoom audio, and a written comment were due on or before July 26, 2022. There were no oral nor written comments, and the department is requesting for final adoption to update the nursing home reimbursement rate to include the use of 2021 general and professional liability insurance costs.
Thank you. Are there questions or comments from the board, please? Hearing none, is there a motion for approval for final adoption?
This is Dr. Lee. I motion to approve for final adoption.
Motion's been made for approval from Dr. Lee. Is there a second to that motion?
Second, Anthony Williamson.
Second
sorry.
from David Cruz.
David Cruz has seconded that. All in favor, say aye.
Aye.
Opposed? Abstaining? Hearing none, it is approved. Final adoption. Thank you.
Thank you, Mr. Chairman.
We'll move to our next item that will be considered for initial adoption, and Brian Dowd will make the presentation and on medical assistance plans for a state plan amendment. Please, Brian, proceed.
Thank you, Mr. Chairman, Commissioner, members of the board. January 13th, 2021, we at the department presented for initial adoption an adjustment to the rates for psychiatric residential treatment facilities, or PRTFs. We hence put that out to the normal public comment period, and we needed to come back to you all with an amendment to the initial adoption based on the comments we received. We still anticipate a January 14th, 2022 CMS approval date, as it is part of the normal public hearing and comment procedures. So the department will, the board will remember there's two different parts to the rates for PRTFs. There's a part one rate that is for children who are served under the policy of behavioral health diagnoses. They have a behavioral health diagnosis. And then part 2 is for children that have a behavioral health diagnosis and a co-occurring diagnosis of autism. There were no comments that we received associated with the part 2 rate adjustment for children with a co-occurring diagnosis of autism. But we did change the rate methodology for part 1, what we're using to establish the rates. The change was what we initially presented in January is we used the 2019 cost reports with a 5% inflation adjustment, and we removed the cap that was previously on rates. Due to the public comment, we have come back and amended that. We are now using the 2020 cost reporting, still with a 5% inflation factor added and the removal of the cap. What this means for the individual providers, there are 6 PRTFs in the state. Coastal Harbor Treatment Center will remain at the same rate of $351.62. These are all per diem rates, $351.62. And that's because using the 2020 cost report, their rate was still less than their current rate. So we're going to hold them harmless and keep them at the current rate. Devereaux Advanced Behavioral Health will go from the current cap of $407 to $507.59. Hillside will go from the current cap of $407 to $595.90. Laurel Heights will go from their current rate of $363.57 to $520.07. Lighthouse Care Center of Augusta will remain at its current rate of $318.14, $318.14. Again, their 2020 cost reporting with the 5% inflation factor came in less than their current rate. So we're going to use that SPA provision that holds them harmless to keep them at their current rate. And then finally, Youth Villages, Inner Harbor was at the cap of 407. Their new rate will be $517.89 per diem. That's all 6 of the rates, and all of the 4 that went up more than with the 2020 cost reporting than they would have with the 2019 cost reporting. Now, this reflects a change in the fiscal impact, and it's important to remember that the fiscal impact for the Part 1 rates is the state match is in the DBHDD budget. And we have been working in lockstep with DBHDD. They are 100% with us and able to move to the 2020 cost reporting. They've been our partner in this work along the way. So the new state fund impact for fiscal year 22 will be $139,048.23, or a total funds of $461,188.17. For the entire state fiscal year 2023, we expect the change in the state funds for that Part 1 amended amount to be $552,062.90, and total funds of $1,634,773.17. Again, since we are amending the initial public notice, we are going to do another public comment hearing. That will be on February 16th at 11 a.m. via Zoom. And written comments will be due on or before February 23rd, 2022. I will pause here for any questions the board may have and would respectfully ask for your initial adoption of the amended PRTF rate adjustment. Thank you.
Thank you, Brian. Are there any questions, comments from the board, please? I would just make a comment, Brian, and compliment you in taking the input that you received and making the changes that you've made and come back for the process. It shows the process works, and people that take the time to provide input into the department, it is certainly considered. And I think that's a positive sign.
Absolutely. Thank you, Mr. Chairman.
With that, if there's no further comments or from the board, is there a motion for approval for initial adoption?
This
Also
is Dr.
move to pass.
Sorry, Mr. Crutchfield, did you make that motion?
Yes, sir.
Is there a second?
This is Dr. Lee. I second.
There's a second to the motion. Is all in favor, say aye.
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 Opposed? Abstaining? Hearing none, it is approved, Brian.
Thank you, Mr. Chairman.
Final item for consideration today, Ryan Loki will make a presentation, our medical assistance plans for initial adoption again.
Great. Thank you, Mr. Chairman, and good morning, Mr. Chairman, Commissioner Noggle, and members of the board. I'm going to take probably a different approach than staff have in the past to board presentations, but I want to walk you through a little bit of how we got here, where we're going, and what to expect with these programs over the next couple months or so. As Commissioner Noggle indicated in her comments earlier this morning, this is the first of a series of what will likely be 5 or 6 steps that the department is proposing over the next couple months to dramatically increase the hospital provider payments that exist through the course of what's called supplemental payment programs. You'll recall that the board over the last 3 years or so has put forward a series of supplemental payment programs, either through a directed payment mechanism or an upper payment limit mechanism on public hospital side, on the physician side, and then on the ambulance side as well. And this will seek to leverage that same regulatory opportunity that exists and build upon that, but be in a much more pretty significant fashion once we get all done with this over the next couple months or so. This program specifically is going to be very targeted and limited in nature, what I present to you today. And we can talk about why that is, but over the course of the next couple months, we bring these next 4 or 5 steps to you. It's going to grow the pool pretty significantly, and I'll talk about why that's important as well. Pending Centers for Medicare and Medicaid Services approval, DCH is proposing to implement a new and innovative value-based hospital-directed payment program that we're calling Advancing Innovation to Deliver Equity, or AID. And the goal of this program is really to build upon what Commissioner Noggle has set forth as kind of a directive to us and our teams since she got in July about advancing quality, accountability, and transparency. And this will touch all 3 of those buckets, particularly on the quality side. We have limited the eligible hospitals in this go round to those that are defined in your public notice in your briefing document as those that are state-owned acute care hospitals, or those that are non-state governmental individual acute care hospitals providing more than 63,000 total Medicaid inpatient days based on the 2020 Medicare cost report, and have over 100,000 total in-state Medicaid inpatient days as reported in the 2021 DCH final payment eligibility report. Effectively, Mr. Chairman and Commissioner, what that does is this limits this to 2 hospitals and only 2 hospitals. The first is Augusta University Health System, and the second is Grady Health System. We chose those 2 to begin with because we felt like we needed to be in a position to really, I don't want to say test the waters a little bit, but go before the board and go before CMS and design a quality program that mirrors what had been done in other states, particularly Kentucky, Ohio, and Florida, and be able to limit our partners in the initial go round to ensure that the staff and the teams were prepared from the regulatory side to be able to handle that workload, but also be able to build upon the success in future iterations of this program and expand the pool to additional eligible hospitals. Effectively, what this will do is we'll take the Medicaid care management payments that exist right now up to the average commercial rate. And you can see on your briefing document here, we're planning to leverage about $116 million in state costs that will come through intergovernmental transfer. So there won't be any state general funds associated with this program, leveraging the associated federal funds for a total program amount of about $344 million. As I said at the beginning, this program is meant to be value-based. We have an existing value-based program right now that exists in our Georgia Families 360 foster care, adoption assistance, and DJJ program. And the staff will love me for this, but this has been something that we've been harping on since we got in, and we wanted to talk about expanding value-based programs and quality programs at DCH since we got here, and this is the next kind of logical step for this. On the second page of your public notice document, your briefing document, you will see how we are planning to make this value-based. 10% of the total payments will be withheld in the 3 years, all 3 years of the program, in order for certain quality metrics to be attained. You can see that there's an escalating scale over the course of the 3-year program of the number of quality metrics that they have to hit. Those quality metrics were identified in consultation with Dr. Holloway and his team as part of our Medicaid quality strategy that CMS has approved, and also with Grady and Augusta as well, making sure that they had some level of reasonable success that they believe that they could achieve these quality metrics. So we're really excited about this. We anticipate over the next couple months, probably in late spring, to bring to you the second, third, and fourth steps of this. We wanted to make sure that our teams and Grady and Augusta could go the distance on this program before we started bringing in other folks as well, but expect in probably April or May at one of our board meetings to bring those next steps before yet. Before I kind of walk through public comment, I wanted to thank some folks that have really helped us get to this point, particularly our team here. Kim Morris and Rich Kim have done a fantastic job running the numbers behind the scene. Joe Hood and Brian Lipton have kept me in line, and all the folks that had to put together the regulatory process for this in place. Lynette and her entire team who are here today are always great to help us with. And then some external folks who have really helped us as well. Matt Hicks from Grady has been an excellent resource. And then Carrie Summers and Anna Adams from the Georgia Hospital Association and some outside vendors as well really helped us. So an opportunity for public comment will be held via Zoom February 17th at 10:30 a.m. and written comments are due on or before February 24th to the department. With that, Mr. Chairman, I'd respectfully request that the board take up initial adoption on the Advanced Innovation to Deliver Equity program effective July 1st, 2022. Thank you.
Thank you for that presentation. Is there questions, comments from the board, please? Hearing none, is there a motion for approval for initial adoption?
Mr. Chairman, I move for initial adoption and applaud Ryan and his team for the innovative approach.
Thank you. Mr. Folsom has made the motion for final or initial adoption. Is there a second?
Cynthia Rucker, I said.
Cynthia Rucker has seconded the motion. All in favor, say aye.
Aye.
Aye. Opposed? Abstaining? Hearing none, it is approved. And Ryan, very good presentation. And I add to what Mr. Folsom said. Nice to see the approach that you're taking.
Yes,
We'll look forward to more.
Thank you, Mr. Chairman.
Thank you. With that, does anyone know of any new business that needs to come before the board or any other comments you'd like to make? Hearing none, the meeting will be adjourned. Our next meeting will be March 10 at 10:30. Thank you all for your participation today and have a good rest of the week.
Thank you.